And always take a stool softener, because when you fart, you sneeze, you cough, it's really hurt. Hi, this is Loriely from Philippine American couple. I'm here today for my hysterectomy or I don't know what is that, laparodosa hysterectomy. So what they're gonna do is to cut me a little bit like a C-section to my belly, down to my belly bottom, and remove my uterus and fallopian tube and the mass. They call it fibroids. So I'm here now waiting for the waiting room. They will prepare me for anesthesia and everything. Discharge for us.
What's the matter?
Discharge.
Discharge?
The doctor.
We'll think about letting you go home.
Today is the 24 hours from my surgery. I'm home. I can walk, but my throat is kind of sounds like this because the breathing tube that they put in during the surgery. And I didn't sleep last night because my bladder is full of those fluids that they put you in your surgery, like the dextrose, like that thing. So every half an hour I always go to the bathroom. They cut a little bit there. That's why it's staying on every time I pee. So but the following day it's better, it's not hurt no more. And only my incision, I got 4 down in my belly, and the one is big because I have a big mass, so it's hard to get out. That's why they do those incision. And the one thing is, the problem is when the gas is moving, it hurts. It looked like there's a big worm there. The doctor said I don't need a gas pill because the gas pill is really on your stomach, going through your intestine to your anus. But the gas that we're handling during the hysterectomy surgery or after, it's the one that they put inside your vagina and blow it there. So it's really outside on the intestine to do the surgery thing. So one thing you do is just to eat plenty of drinks so that the gas. Then what I put is, I asked them to have a binder because I put the pillow all night there to keep it warm, and it helps. So I'm doing good, guys. I just need to sleep because I don't sleep last night of my pee. Like, really hilarious. But now I'm home. Everything is got good. David take care good of me. He's feeding me at lunchtime. Like after 4 hours from my surgery, I'm so drowsy. But on the dinner time, I can feed my own self. So no hurry, guys. It's a serious surgery, but the doctor is really good. Bye.
Done now.
Today is my 2 weeks follow-ups from my surgery, the hysterectomy. Since I'm doing well, he's not gonna do a pelvic exam. It will be 4 weeks after now to make sure it's good. But now we're just gonna check or follow-up stuff.
And how are you feeling after 2 weeks, young lady?
2 weeks is good. A little bit gas, which is hurt sometimes, but the incision is a little bit itchy, and it's used to wear a binder so that you're not get accidentally scratched in the night when you're sleeping. So that's my tip. And always take a stool softener, because when you fart, you sneeze, you cough, It's really hurt. So that's it.
Pretty good.
Sometimes it's gonna hurt. Close to my vagina when it's kind of gassy, but then I have a little bit spot that you told me. It started there like 2 days ago.
Okay.
It started.
But it's just light. It's just a small.
Yeah, it's like a stain.
Okay.
I have a picture, but I don't want you. Maybe you don't like to see it.
Well, that sounds very normal to me. So,
Yeah.
any issues eating, drinking, going to the bathroom, bowel movements, anything like that?
Yeah, I'm still taking a stool softener.
Okay.
Yeah, because it's gonna hurt too.
Right. Okay, good.
Yeah.
And it sounds like pain control is actually pretty good. You know, you only took pain medicine, like the heavy stuff, for a few days.
Yeah, because it makes me like I'm high.
Kind of dizzy. Yeah.
Because I don't want to sleep all night.
That's what it does.
This is your pathology report.
Oh, okay, I read that.
So this is kind of, long story short, they kind of break it down into parts of the anatomy. So looking at the cervix, that means there was nothing abnormal even for them to even say. Sometimes they'll say, oh, there's maybe some mild inflammation or something like that. Completely normal. With the lining of the uterus, it's inactive, meaning there wasn't any, precancer or anything going on. Adenomyosis is where sometimes the glands from the endometrium can get embedded into the muscle lining. And you see that through a number of things, even for folks who've never had kids. Sometimes fibroids can do that through just the kind of the inflammation process. And then leiomyomata is the medical term for fibroids. So everything was benign, and then the fallopian tubes were also normal, like we thought they would be.
Okay. Is that fibroid? Is it like a myoma? It's different.
Fibroid, another name for a fibroid is a myoma or a leiomyoma. In medical jargon terms, we sometimes use those interchangeably. And then these are just the pictures from your surgery. Do you want to see?
I do.
Yeah, it's cool, but this, maybe I want to think it for myself.
All right. So these are all looking through your belly button. Okay. This is looking up in the right rib cage here. Okay. This is the right lobe of the liver there, and then kind of looking over here. This is the left lobe of the liver, and then the stomach over here, kind of in the left rib cage area. And then looking down into the pelvis, your uterus was so big it literally wouldn't even fit into the picture, so I don't have a picture of it. But this is one side of it here. This is looking, I gotta turn my head to make sure. This is the left ovary and then the left fallopian tube here. That looks normal. And then this is another side of the uterus, and this is your right ovary and the right fallopian tube here. Okay.
Before you cut it.
Before we cut it and removed it, yeah. So,
that's
and like we said, we left your ovaries where they are, so they should still be functioning for many years to come. So,
my souvenir.
All right.
She probably doesn't remember one question she asked. Now, when you took the largest mass out, did you chop it up or bring it out whole?
We took it out whole.
Okay.
Oh.
Yeah, I didn't have to cut anything up. I didn't have to debulk anything.
Hey, it looked like almost 1 week. It's hurt in my vagina.
And I think that's because your uterus again was so big. It was not unlike you having a kid.
It's not like it stretched because of the mass.
That what you mean, the vagina?
No, the fibroids, the way my uterus.
Yeah, the
stretch.
uterus. It over time it really kind of stretches and gets bigger. So, because let me see if they even say here.
They just total the way, but not. Like
Well, a lot of times they'll say, yeah. So one of the fibroids was up to almost 5 centimeters. So.
It was big.
So, can I take a look at your incisions?
Yeah.